Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Safety features of machines and circuit. Backup cylinder that contains oxygen, and the backup cylinder may have half should have half of full oxygen. That is, backup cylinder should contain oxygen at 1000 pound square inch. Oxygen nitrous oxide proportionating system. In oxygen nitrous oxide proportionating system, oxygen and nitrous oxide are always released in fixed proportion. Oxygen tube is the most downstream. Oxygen analyzer is oxygen analyzer will analyze the final delivered oxygen concentration. For monitoring in newer machines, the expired gases can be monitored for concentration and volume. So, for safety features of an anesthetic system, we have four. One, backup cylinder. Backup cylinder contains oxygen, and this oxygen backup cylinder is at least fully filled or half filled. It should be at least half filled at a pressure of 1000 psi. Second, oxygen and nitrous oxide proportion system. This oxygen and nitrous oxide proportion system should always be present. So when you open the nitrous oxide, oxygen will also be released in a fixed proportion, so that the patient does not feel hypoxia at any time during the anesthesia. Oxygen tube is always downstream. Whatever we do, the oxygen tube should be downstream, so that if something wrong happens during the anesthesia machine, the oxygen can be pumped easily to the patient. Oxygen analyzer is this oxygen analyzer will analyze the amount of oxygen that is given to the patient, and also it analyzes the final delivered oxygen concentration to the patient. And based on that, if the final delivered oxygen concentration is less, then even an oxygen alarm is put, and this alarm will ring when there is any deficiency of the oxygen delivery to the patient. So nowadays, even monitoring in new machines, there are some expired gases which can be monitored. That is, concentration and volume of the expired gases can also be monitored with the help of these new machines which were there.
thank you and thank you for watching.